Hello, how are you doing today? This is Dr. Janson, and I thought I'd make a little short video on something interesting today that I don't see too often. It's making a pair of orthotics for a mother and a daughter on the same day. So here are the casts. This is 6-year-old Sarah, and this is her mother. And what's interesting about Sarah's foot is that her two legs are two different lengths. And that can happen with kids as they're growing. One side just starts growing more. So you notice that on this foot, that Sarah's heel is this wide. And then we notice on the other foot that the heel is much less wide. You see that? So this heel is much smaller than this heel. And you also notice that this foot is a lot flatter than this foot. This is a high arch foot, and this is a flat foot. I don't know if you can see the difference between the two casts. And another thing that we notice is that there's an angle between the front and the back of this foot, and this foot is pretty straight. And that's true of the mother too. Look at this. See, there's an angle in the mother's left foot. This is the left foot. You see that? And the other foot's pretty straight. And what's really funny is, do you notice that the angled foot is different on the mother versus the daughter? So that sometimes happens. But now this is the mother, and I've ruined the mother as an example because she had very flat feet, but she's been wearing my orthotics for about 10 years. So where her cast used to look like this, which is pretty flat, she now has a very nice arch. But she's on her the mother's on her third pair of orthotics. And I also treat her mother. So this is a 3-generation family I treat, actually. But you can see the difference between the 6-year-old patient has never had orthotics, and the mother has had years of orthotics, and the foot is better. Both feet are better. Okay, so how are we going to treat Sarah? Because she has two different feet. So what we want to do is make two very different orthotics, so that as the foot is growing, we're putting pressure to straighten out the feet and make them more symmetrical. So remember I told you that the legs are two different lengths. So we're going to put a heel lift, obviously on the right foot, but we're going to put a heel lift that makes this leg much longer than the other leg, so that pressure makes this leg grow faster. And because we have an angle in this foot, we're going to change the cast by taking away material here on the outside of the orthotic, so it helps push the foot straight. But on the flat foot, we're actually going to remove material from the other side so we can push the foot so this is not so flat into a straightened position. So you see how they're opposite? On this foot I'm going to take away on the outside, and on this foot I'm going to take away on the inside with my tool here. So changing the cast like this means that these two casts are going to be very different. The two orthotics left and right are going to be very different. And altering the cast is how we help straighten out the foot. And Sarah will grow up and have much less chance of things like scoliosis, pelvic displacement, pelvic tilt, herniated disc, bad knees, etc. by having a more symmetrical skeleton. This is what 3D printed orthotics can't do, is to change the cast into the foot that it should be. Okay, so now I've made the orthotics. I still have a lot more work to do on these, as you can see. I thought it'd be really cute to make the orthotics the same color for the mother and daughter. And they're coming together to get them, so the daughter will accept the orthotics better when she sees that her mother is getting the same thing. And here you can see that this orthotic has the buildup of the arch, and this one does not, but it has a buildup on the outside here. And the other thing is that one orthotic has a heel lift and the other one does not, because this is the short leg, and I'm building that up quite a bit to actually make it the long leg so that it will begin to grow faster and become equal with the other leg. And of course I'll keep my eye on this over every 3 months or so to make sure that the amount of support is correct, because the feet will begin to straighten out and then they don't need to be so different. Okay, so there we go with mother-daughter orthotics. If you want to see in detail exactly how I made the orthotics. There's an even longer video that shows exactly how I put the orthotics together.